Welcome to PTCE 2026 Drug Stability Mastery. This video offers a comprehensive guide to drug stability, covering key concepts for the pharmacy technician certification exam. A critical difference is between manufacturer expiry and beyond use date, or BUD. Manufacturer expiry is based on the unopened package. BUD applies after the drug is altered, and the shortest dated choice applies as the final expiration date. For amoxicillin oral suspension, both room temperature and refrigeration allow a BUD of 14 days after reconstitution. The exam trap is assuming room temperature shortens stability. It does not in this case. Always label with the discard date. Oral suspension stability relies on physical appearance, chemical pH, and microbiological quality. For safety, ensure uniformity after shaking, check for consistent color and texture, and monitor pH. Insulin stability is vital. Unopened vials are refrigerated until expiration. Once opened, store for up to 28 days. Never freeze insulin, and discard it immediately if it appears cloudy, clumped, or contains particulate matter. USP 797 defines beyond use dating for low-risk compounded sterile products, CSPs. Non-preserved solutions allow 1 hour at room temperature, 48 hours refrigerated, or 45 days frozen. Preserved or closed systems double these timeframes. Vaccines require stringent cold chain management. Refrigerated vaccines are stored at 2 to 8 degrees Celsius, while frozen vaccines, like varicella, are stored below -15 degrees C. Temperature excursions lasting over 30 minutes require immediate reporting. Multi-dose vials like insulin are stable for 28 days after first puncture. COVID-19 mRNA vials, once punctured, have shorter stability, such as 12 hours at room temperature. Always document the date and time of first puncture. The Drug Supply Chain Security Act, or DSCSA, requires strict procedures for suspect products. If stability is compromised, immediately quarantine the product, verify transaction data, and report to trigger an investigation. For cold chain distribution, use only authorized drug distributors. Verify their license. If a cold chain breach occurs, the product is illegitimate, and you must report it to the FDA via MedWatch within 24 hours. Common exam traps include confusing expiry versus BUD, ignoring the shortest time rule, forgetting insulin's visual checks, mixing up storage temperature rules, and failing to report temperature excursions. A high-yield mnemonic is 28141 to lock in key expiration numbers. 28 days for opened insulin, 14 days for reconstituted antibiotics, and 1 hour for non-preserved IVs at room temperature. For amoxicillin powder reconstituted today and refrigerated, the discard date is 14 days from today. This is independent of the original manufacturer's expiry date. If a patient stores an opened Humalog pen in the freezer, the correct action is to discard it. Freezing precipitates insulin, blocks the needle, and cannot be restored to stability by thawing. If an HPV vaccine is left at 25 degrees Celsius for 2 hours, you must quarantine it and report the excursion. Policy often requires immediate documentation and review, even if stability data suggests a longer time frame is okay. A non-preserved metronidazole IV, admixed at 9 a.m. in a low-risk batch, has a discard time of 10 a.m. the same day. USP 797 permits only 1 hour at room temperature without a preservative. If a refrigerated shipment arrives with a temperature excursion, quarantine the product immediately, notify your supervisor, and file a DSCSA suspect product report within 24 hours. Patient safety is the priority. For stability questions, practice time management, detect cues like temperature and reconstitution, use the 28141 elimination rule, and always practice conservatively by choosing the shortest dated choice if unsure. Strategically, flag questions requiring complex math and return to them later. Focus your stability study on the medications domain and the patient safety domain, which account for a high percentage of stability items. Quickly recall key stability regulations. Insulin room temp limit is 28 days. Amoxicillin BUD refrigerated is 14 days. Non-preserved IV at room temp is 1 hour. Varicella storage is frozen, and the DSCSA report window is 24 hours. Remember, repetition and verbalization enhance retention for exam success.